We're in the midst of a huge transformation where our peers, communities, and workplaces are all really melding into one. Welcome to Reimagining Company Culture. My name is Christina Giordano, she, her, and hers, and I am the Senior Partnerships Manager here at AllVoices. Today, I'm very excited to welcome our next guest onto the interview series, Amira Barger. She is the Executive Vice President on the Global Health Sector Team, Diversity, Equity, and Inclusion at Edelman. Amira, thank you so much for being here with us today. If you want to share a little bit about yourself for our listeners, including your pronouns, and when you were younger, do you remember how exactly you answered the question, what do you want to be when you grow up?
Oh, I love that question. Well, hello, and thank you again for having me. I'm so glad to be in community with you here today. Amira Barger, I am a business leader, a DEI practitioner, executive vice president, as you mentioned, at Edelman, but more importantly, I'm a Black working mother. My pronouns are she, her. And when I was growing up, I wanted to be one of two things that are very different from each other, a pediatric oncologist or a pop star. And the divide between the two is wide.
I love that. I also wanted to be like a talk show host, a pop star. So I definitely
Nice.
relate to you in that way. I personally believe that we all have a role to play in creating more equity in the world, both in work, outside of work as well. What unique role do you see small, medium, large size kind of health employers or clients playing in creating more equity in the world from their platform?
Mm. Two things come to mind that organizations of any size, like you said, small, medium, large, can absolutely do to create more equity in the world. The first is, and both of them happen to be introduced in 1998 by chance, cultural humility over cultural competence. And then the second is working through the patient's eyes. And so I work in the health sector. And cultural humility training came out of healthcare and was introduced in 1998 in response to implicit bias that we were seeing and studying in the interaction between patients and their healthcare providers. And it's a little different than what people normally think of as cultural competence, because when I think about competence, it's sort of this unrealistic goal of learning and amassing knowledge about all of the people who are different from you, which is pretty unrealistic if you think about it. But cultural humility is a different framing, right? It's about this sort of ongoing and lifelong effort to celebrate people's humanity, their differences, to be reflective, and to seek to understand and learn about the people around you. And so I love the framing of cultural humility is something that we can all practice. We can all stay curious about the world and about people around us that will help us think about how we engage with patients in the healthcare sector, our coworkers, our family members, and the people that we love and our neighbors. And then the second thing I mentioned is in 1998, Valerie Billingham was presenting a session at the Salzburg Global Seminar, and her title of her session was Through the Patient's Eyes. And she talked about this idea of patient-centered wisdom in capturing how we move things forward in healthcare. And she said specifically, nothing about me without me. And that is a principle and a concept that I think we can all practice in the healthcare sector to really think about how we bring people who are most impacted by our decisions and our policies into the room and really listen intentionally to what they need, because they are most equipped and closest to the problem to help us craft solutions and think about what does equity and what does justice look like for them.
Absolutely. It's really important to really have people in the room, not make assumptions or decisions for people without them in the room, and really be in conversation with one another, seeking to understand, coming with humility and curiosity. And these are big questions that we are seeking to answer. Can you tell us about kind of an example of how you consult with Edelman Health clients in their diversity, equity, and inclusion strategy? We know that a lot of folks are trying to engage in this work and be really meaningful. What questions are you trying to really help them solve in their processes and really on a systemic level?
Edelman is known as the House of Trust, and we conduct our trust barometer report every year. And this year, 2022, we did a special report on trust and health. And so when I think about our clients and how we're consulting right now, our ambition at Edelman, we feel, is very clear. We help our clients earn and keep trust. And the sort of reckoning we're having with the pandemic that we're all experiencing has put us in this place where we're starting to understand that we are in a health first era, right? The demands are in full view all around us around health promotion and health equity. And there are really four key things that we have been talking with our clients about when it comes to building trust, because our report showed that trust is a key determinant of health behaviors and health outcomes. And so one of the first things is, break through the information barrier, right? How can you elevate and amplify trusted voices that are in communities? And what we're finding in terms of building trust is that you have to go very direct and you have to go local. Get back to those local voices of people who know and understand a community and are trusted voices to help share information about key health behaviors and outcomes that we want people to participate in. The second thing we've been talking about is to make sure as an institution that you're thinking about building trust, not only in your own organization, but all across the health ecosystem. You have an opportunity to play a role in building people's confidence in the very evolving public health measures and expert recommendations that we're hearing about. And so community-based organizations are things to think about in terms of partnering, right? Go outside of your organization and think about how you're impacting communities. The third thing we're talking about is, employers across all sectors have a great opportunity to influence health outcomes right now. Employees are actually looking to their employers for vetted and good information that is reliable when it comes to health policies and the kinds of choices that we can each make together and individually to promote good health. So employers need to vet information very carefully and have a consistent cadence of helping their employees have access to that information. And the fourth thing that I think about and the ways that we're advising our clients is to build resilience and prepare for the next public health crisis, right? And one of the ways we can do that is by addressing disparities in health outcomes. So you can engage in issues like climate, you can engage in issues like poverty, racial and social justice, right? We know that these things are very widely understood now to undermine good health behaviors and outcomes, and we have to engage in these conversations and issues.
Absolutely, there is an intersectionality in these issues and really
Exactly.
understanding, yeah, how we can support people, and also to your point as well, just this expectation that employers and folks are really taking care of their people. I know we've had so many conversations of folks really leaning into authentic mental health care benefits and really destigmatizing the conversation around burnout, not only with
Mhm.
your job, but with the many different roles that you wear inside and outside of work. It encapsulates everything as well. And I would be remiss if I didn't ask, how have you worked with folks in really discussing impactful strategies to really proactively address burnout before you get to that point, amongst healthcare practitioners, and ensuring they receive that critical care, because they're caring for a lot of people, especially in the global health crisis we're in right now. And you mentioned kind of preparing for the next one too. So really being intentional about thinking about burnout.
Burnout. So I was really happy in 2019 because the World Health Organization classified out as a diagnosable medical condition. And the way it's described formally is it results from chronic workplace stress that has not been successfully managed. So I think that was an important step in helping people address burnout, is classifying it as diagnosable and putting some language to how we describe it and what it is. And I was reading a report from Headspace Health on their workforce attitudes towards mental health. It just came out a few weeks ago. And one of the things that stuck out to me is that 71% of the employees said their company has increased focus on mental health because of the pandemic in particular. Yet only 25% say that their employers have kept that focus up, which is really interesting. And so when it comes to our workplaces and how I advise clients is you have to have a culture of well-being and think about the whole person. And that culture of well-being has to be codified and coupled with ongoing support. So think about things like your employee assistance program and the benefits that you're offering to your employees so that they can access services and help that they need. And then cultural humility, which I mentioned earlier, and that helps us account for, the nuances of a person's identity, but also this sort of cross-generational consideration we're having because there's so many 4 generations in the workplace together right now, and there are different needs and considerations. And I see that because there's less rigidity, I think, in many industries for work setups and boundaries and how people show up in order to protect their mental health and to guard against burnout as well. So employees want new things as they reflect and reevaluate their reality of their working situations. And for the first time since the pandemic started, we're seeing COVID-19 related stress fall, which I think is great. And it's important because it can contribute to, burnout and the tsunami of resignation that so many industries and institutions are seeing. Employees are stressed out and they're reporting it. They've missed work due to mental health. They're not as engaged in their work. So we have to be open and curious about the ongoing support and resources that we're giving. And the simplest thing I tell my clients is every study shows that just 20 minutes of activity a day can be transformative. So helping your employees, giving them the space and the resources to actually lean into that 20 minutes a day, whether it's, scheduled yoga or at Edelman, we call them balance hours, just a moment for people to pause and have 20 minutes of an activity, reading a book, doing yoga, walking outside and getting your vitamin D. Those micro activities are anything but micro because they're not insignificant. A multitude of micro activities over time can actually be really impactful for people.
Absolutely. And really setting up those non-negotiables, really codifying it as you were talking about as well in terms of job design flexibility and really thinking about how can I tangibly impact someone's day? Can this be a walking meeting so you can get your 20 minutes of activity every day as well? And there are things that managers can do, senior leaders. I know benefits are huge and it's something that we want to continue to work on, but it takes a process and a time to roll out and conversations. And we know that that is really important for systemic change. Healthcare is really it's critical to really think about these systems. But I also want to talk about that individual onus of folks who are leading teams every day, talking with people and really modeling that behavior. How do you counsel really help client leaders to make sure they're making changes tomorrow and really creating more equity in their everyday actions, similar to the micro moments, micro actions that really bubble up to something much larger, a cultural shift when we look back, 5 years, even a year from now?
Be an accomplice. Some people use the word ally, I prefer accomplice. As a leader of people and as a leader of a team, be an intentional accomplice, lock arms with those who need you and who are impacted because, inclusion and equity are not as simple as inviting people to the table, right? Or as crafting solutions without requesting or honoring the ideas of those who are most impacted and most vulnerable. And we need to invite people to the solutions table, or better yet, build the table collaboratively, right? And then solicit input with really genuine intent to listen, hear, and act on that input. So leaders can do a listening tour. Leaders can do individual interviews or focus groups with their teams to understand, qualitatively, what are people's experiences within the walls of our institution, and how are those impacted by the practices and the procedures that we are amplifying and espousing within our organization. And an accomplice helps to make changes where they are needed, even if it's a micro change, because those changes can be the things that really tip the scales for people's experiences in your organization. And I also tell leaders to simply start somewhere, right? The journey is long, and it's ongoing. So just start somewhere with your people. And there's a great article by the Harvard Business Review on how to build an anti-racist company by James D. White. And he outlined 7 very detailed and specific starts, if you will. So start somewhere, from identifying your champions, using common or shared language, disaggregating your data. There are a multitude of firsts that leaders can take to be a champion for equity and inclusion in their workplaces.
Yeah, absolutely. Be an accomplice. I think that is a really active word as well, to take action, really engage in the conversation and make changes. It's never too late to really start and engage in this work.
Right.
As we have talked about, a lot of organizations really want to engage. They want to really listen to their employees, build that trust. And there are a lot of initiatives, strategies that are being implemented, and people want to know, is this working? Are we doing a good job? What do we need to double click on and really invest in? What is your philosophy around measuring progress around diversity, equity, inclusion, and belonging initiatives, knowing that we don't want to check a box to say, okay, we created this really equitable environment, we don't have to work on it, we hit these goals, but you want to make sure that things are getting invested in, and you want to celebrate what's working and really fix what's not.
Generally, my philosophy is that things need to be measured both qualitatively and quantitatively. We have to both show and tell. Of course, we need to set specific goals that are tied to numbers, right? What are the demographics, and by when, and how many, women and people from historically marginalized communities in senior management, and by when. So yes, there are numbers that we have to track, and there are many resources to think about those. But I really think about the qualitative piece because it's so often on the back burner for many leaders and organizations. I think about the Crown Act that just passed, right? This has to do with Black hair discrimination in the workplace. And the stories of people's lived experiences as it relates to their Black hair is measured in more than numbers and instances of, discrimination experience. And hearing those stories, it helps us unpack and think about policies and practices that we can change as leaders. And of course, we can find ways to measure it, but the qualitative piece of listening and learning and hearing from employees about their lived experience helps us think about the things that we need to change, the behaviors that we need to espouse as an organization. And that's part of how we came to this place of the Crown Act being considered and being passed, is both the show and the tell of hearing those stories and standing up programs that actually and materially impact people's experiences within institutions. So it has to be both, but I often will talk about the qualitative piece because people always want to go back to the numbers, and that's not the only part of the story that needs to be told.
Absolutely. You can't just look at numbers to tell a full story, and you really need to implement that storytelling and also really actively listen. I love that example. I think that is so important to highlight too. And in terms of this kind of transformation we're seeing happen as well, and people really leading into this work, it requires everybody. I do think leaders have a unique role because they're in positions where they can really change systems, change policies, but it does require everyone. So I want to ask, how do you recommend clients really ensure there is accountability across the organization to really think about equity, think about their processes? I know that there's been a lot of articles and kind of sharing of new initiatives around it being related to executive performance, it being related to kind of that review cycle as well. Again, going back to the quantitative and qualitative ways to think about accountability?
It does come to both informing and incentivizing new behaviors, right? I do advise a lot and hear a lot about officer action plans, right? Not only having each of your officers or leaders having an action plan related to advancing equity and inclusion and belonging, but also making those plans available to employees, right? Let's be transparent and make the invisible visible. That's a really important principle and concept of how we practice diversity, equity, and inclusion, and something that I believe in. It's that procedural transparency, and it's a term from the world of government. But in government, we understand, public access for city council meetings and the way decisions are made and the way policies are decided. It's very public and open, and I think there's so much we need to adopt of that in our corporate and nonprofit spaces and institutions, in order to both inform what's happening and why, but also to incentivize leaders to actually stick to those plans and make changes for employees and people who are impacted by the policies and practices we are advancing and putting forward. So that's really important. I also think about the way I advise clients on sort of the 5 building blocks for successful change, the ADKAR model. So are we building awareness of the change that's needed? How are we supporting people's desire to support and participate in the change? So we need to make space for them to do so, to adopt a new policy, to give them space to have the time to engage in these things, knowledge of how to change. And sometimes that looks like training or an employee or a manager toolkit. There are some tactical things we have to have on hand. And then the ability to implement required behavior changes. How are we upskilling people? Do they know how to use equitable language? And how can we give them those skills so that they can actually participate in the behaviors we expect? And then reinforcing it in order to sustain the change, right? We can ask people to change their behavior as individuals, but it's not sustained unless there are policies and procedures within the organization to make sure that it's long term.
Absolutely. Really setting people up for success, having that common language and setting those expectations up front, but also making those action plans really accessible for transparency and accountability. I think that's also really important as well. And I think it's a change we've seen over the last few years. I don't think we'd be talking about kind of making these plans in the first place and also making them accessible to employees at the organization too. And we've seen a lot of kind of change and innovation in the space because of the power of the employee voice and what people are asking for and what it means to really enable people to do their best work, making sure people feel seen, heard, and understood in a really intentional way. Is there an innovation, a pivot, or a redesign specifically in the healthcare space as it relates to people, culture, diversity, equity, inclusion that you are really excited by?
There are several, particularly in the healthcare space where I work, and I'll bucket them under sort of the umbrella of sustained innovations and disruptions.
Okay.
And some examples are hospitals at home. We've seen that a lot in the time that we're in, the last 2 years in particular. And the idea of hospitals at home benefits, low socioeconomic status patients, medically underserved patients, and it enables them to get the care that they need at home instead of at a hospital, which often can reduce costs, improves their experience and their health outcomes. And so we're seeing that being practiced more and more, which makes me think also about mobile health clinics for rural patients, particularly for dental needs in the healthcare space. There aren't enough dental practitioners in rural communities, and so mobile health clinics have been really important and transformative for communities who can't get into these big metropolises and areas. And then I also think about multidisciplinary clinician teams, because medicine is a cooperative science. And so everyone from lab techs to the nurses, to the physicians, to the specialists, everyone works together as a team to really solve complex health needs for patients, to treat the whole patient, not just the particular ailment that they have, but what are some other needs that are leading to that? And can we get to this idea of the root causes of how they got here and thinking about them in a really holistic way. And I'm glad to see some of those disruptions being sustained today, because we need that in order to provide true equity and access and opportunity for patients who are on the other end of these decisions that we're making as healthcare organizations.
Absolutely. I think those are really key examples, and also coming to the table, which goes back to what we were talking about earlier with those questions, with that curiosity, and also not assuming people's ailments and what it's related to, really providing that context, serving communities, and being really intentional. Are there any other patterns you're seeing, or problems or questions, solutions that really health clients are looking to solve, especially over the last few months?
I've been talking with clients a lot about this idea that we need to ask more questions in healthcare, especially about the systems that we have today and the historical context for how we got here. And two core questions that I continuously ask myself, but also ask our clients are what is invisible to many and whose interests are being served? And an example is, for years, medical billing was invisible to many people. And then we saw a pivot to organizations hiring health navigators. These are people that can aid patients in understanding things like billing codes and the most right questions to ask so that it does not impact their costs negatively. And then I also think about how each of our 50 states here in the US collects data on health differently. And there's no centralized system that we can access. And that is still invisible to many people and impacts the policies and the experiences that patients and healthcare providers have all across our communities. So we have to ask more questions. And if we ask more questions, hopefully it aids us in illuminating the things that are invisible and the realities of whose interests are being served, so that we can then face those things and work to change the systems that we have today.
Yeah, I think those are two really pivotal questions in terms of whose interests are being served, who designed these systems, who is it really in service for. Business as usual is something that I feel like is codified language as well. And we need to really think about consistently auditing our processes and making sure that we are coming in with that curiosity as well. Is there anything that I didn't ask that you want to share with folks who are listening, or maybe highlighting a couple key takeaways from the different topics we covered today?
I mentioned, I'm a practitioner of both DEI and strategic communications, and the COVID-19 pandemic has thrust a lot upon all of us and brought back to sort of the top of mind the need for healthcare communications, right? It's central to public health, and it's really something I want people to remember, because that's how we deliver evidence for our behaviors and our reality. And as healthcare communications practitioners, we evangelize the most accurate words and framing. And the idea is that, communications serve to shift mindsets and change behaviors, which changes experiences, which changes attitudes. And if we can use communications to change behaviors, experiences, and attitudes, the hope is that we beget a different outcome. And that's what I want people to remember and walk away with.
I love it. Thank you so much for being on Reimagining Company Culture this afternoon. I really enjoyed our conversation.
Thank you. Such a pleasure to be here. So glad to have this conversation, and hopeful that it imparts some nuggets of wisdom and information for those who are listening.
Of course. And as a reminder for folks who are listening, AllVoices really believes in employees and employers really being seen, heard, and understood, and know it's a requirement for the business to really succeed overall. Have a great rest of your day, everyone.